Mr. Dr. Vikram Chauhan. Mr. Chauhan, what we cannot avoid the opinion of Western medicine about Ayurveda. Could you tell us what are your experiences with Western medicine, or maybe more exactly, what is the opinion of Western medicine about Ayurveda, and actually how often it is used in India?
Uh, Thank you for hosting me, having me here. Okay,
That
little bit louder.
No,
Slower?
far from. Yeah, that's okay. That was okay.
Okay.
So like this.
So thank you for having me for the interview for this Radio Maribor. I'm glad to tell you about Ayurveda here. And Ayurveda is ancient medical system, as I told you before. And many Western doctors, they are also looking at it in a very positive manner. They are opening up now, and they see the results. Previously they were saying that it is not working, maybe something false medicine, maybe it's just like a tradition or a culture. But now when they are seeing educated people coming in this field, and now they see I have done MD in herbal pharmacology, so I'm using the herbs, and there is a lot of research already going on from modern perspective also, modern angle also. Modern angle is looking at the herbs as what is the active constituent which is working in them. So modern doctors are also using the herbs. They are also coming to us for their treatments and for the treatment of their family members, because sometimes the traditional way of looking at the things is different. So we look at the things from different angles. So modern doctors are also opening up, they are learning, and they are integrating this ancient medical system with the modern system.
Um, yes, but probably you were describing the situation in India. In Slovenia, we don't have many, or we have a few examples of combining, let's say, the Western medicine with more alternative or new approaches like Ayurveda. Could you describe it? How would you describe it, or what is the situation in Europe if you compare it to other parts of the world? For example, it's more spread this in India, or it's probably less spread in Europe. How would you describe the difference, or how do you see things standing?
Yes, it is a very good question you asked. Modern doctors or classical doctors in Europe, they are opening up slowly. In India, they have opened up. In India, they are now using Ayurveda herbs also. They are using Ayurvedic medicines, and even sometimes I see recommendations from modern doctors. Some patients coming to me referred by some specialist, gastroenterologist or hepatologist or a hematologist for different complicated problems. But here in Europe, uh, slowly when they see the patient is not, there was a case in Macedonia. My patient, she was having serious cancer, big tumor which was spread to vertebral columns and certain areas where it couldn't be operated. When she used Ayurveda medicines, and the modern doctors, they were really meetings and planning how we can do, because the surgery was not possible. And meanwhile we did the treatment, and it disappeared. So it was surprising for the doctors, and the doctor himself came for a consultation from me for his problems and his family relatives problems. So modern doctors, slowly when they will see that the results are there, the herbs they work, they will also open up here also. Now the situation is not so positive. The modern doctors, they don't see it as a very positive development. They see it is something still very traditional, very outdated, not working. Slowly the opinion will change.
And I wanted also to ask you, when you treat your patients, you combine the principles of Western medicine and Ayurveda, or you just treat them with Ayurveda? Could you, or maybe also another question, where is the, or did you reach the critical point on which you said the Ayurveda is not working, I should start to treat with the principles of Western medicine?
Combining, I never felt the need to combine, take the help of modern medicines. And in my practice, patients, they come from such a situation where the modern system has already given up. Usually in such a situation, certain liver failure patients are there, the liver transplant is advised, and the patient is poor or cannot have, maybe for certain reason transplant is not possible, and they come to Ayurveda, they come to me, and I am giving them all herbal medicines. Not, I'm slowly I'm reducing their modern medicines, and I'm seeing good results. That is something amazing. Even when we were student, we thought that maybe it is possible. Maybe I will need help of modern medicines. Maybe I will need. I will come to a point where I will have to recommend the patient to modern doctors. But it is happening opposite way, reverse way. The doctors have given up, the cancer has already spread, or the liver failure is so much so that there is ascites, there is too much water, the bilirubin levels are very high, the yellow pigment is very high, and there is no way to bring it down. And we have herbs which are bringing it down. The, the doctors, they are giving albumin to increase the albumin protein in the blood so that there is no water in the abdomen. But in Ayurveda, I'm using certain herbs like tribulus, and I'm able to increase the albumin naturally. I don't have to give injections. They are already taking injections and they are not working, and they are expensive. And there are diseases like ITP or thrombocytopenic purpura, idiopathic. It is kind of where the platelets are really low and they are not going up. The doctors are using steroids, immunoglobulins, immunosuppressants, so many drugs, and they are not working. And I'm using herbs, using Ayurvedic medicines, and they are cured. So I'm seeing wonderful results, miracles I would call them. So I want to invite the modern doctors to see me in my clinic and see my patients, and then they will see what is happening.
When you talk about good results of treatment and things like that, what would you say are the warning signs that a patient needs the treatment with Ayurveda? When do you or any person, when do you find out that this balance is crushed, if I say it so? When do we have to start with treatment? What are the warning signs?
For example, if there is a bottle, glass bottle, black colored, and the water is rising, and up to 10 degree, 20 degree, 50 degree, 100 degree, and when it is up to level of 101, the patient doesn't see any symptoms. Or when it is 99, patient doesn't see any symptom. When it is 101 or above 100, the patient sees symptoms and he goes to the doctor. This is what is happening normally. But Ayurveda, as I told you, is knowledge of life. It is preventing the diseases to occur from 0 to 10. Whenever it is going to happen, we are telling the patient, you can prevent them. Still, if the patients, they go to 88, 90, 95, 99, 101, and they come to us, we tell them, You have to change your lifestyle, you have to change your diet, and the symptoms is just an indication. Whenever the first symptoms appear, that means you have already crossed 100 points. So you need to make them to zero. Disappearance of symptom doesn't mean your disease is gone. It is appearance of symptom is means 101 points. Disappearance of symptom means 99 points. So disappearance of disease should be 0 points. So we have to bring the patient from 99 points to 0. So it takes time. Even if the patient is free from symptoms, we keep continuously telling him or her to make changes in the lifestyle, in the diet. So this way we treat the patient.
You travel a lot around the world. Why are you so passionate about presenting the Ayurveda to the people?
It is something I saw it as a miracle, and I want to share it with everybody. It is like I found something good, so I want to share it with the world. So if the people who are listening, they are seeing the benefits. Who are not listening, it's okay. So it has become my passion. It is what I like. So if you find something good, obviously you would love to tell to others. So that's why I want to tell it to everybody on the planet.
When did you hear for the first time about Ayurveda? When did you first meet with this form of treatment?
That is another interesting question. When I was in school or high school, I was planning to become a doctor, modern doctor. And then I gave the exams, I studied Ayurveda along with modern medicines. I studied modern medicine. I had too much interest in the classical medicine. But slowly, when the course was complete, I saw in the hospital the patients are coming and they are going, and the same patients are coming again and going and coming again. Nobody is getting healed. I was working in some orthopedics department with my senior. I was learning from him, and patients of arthritis are coming. They are given the medicine. Patients of blood pressure are coming. Patients of cardiac problems coming again and again. It's continuous process. Then I heard about a Ayurveda practitioner. His name is Dr. Madan Gulati. I heard about him that he is doing miracles. I went to him in my city. He was doing miracles, and I told him I want to learn from you, and he taught me these principles. And I was seeing the patients, they were happy. They were not coming, they were bringing more patients. They themselves were happy. So this is how I came to know that Ayurveda is a miracle. So I decided to do further specializations in herbs. So I joined this next course. It was post-graduation in this field. So after that I developed the interest. And later on, that Dr. Madan Gulati and myself, we were very much in love, and his daughter is now married to me. He is my father-in-law now. And he is still practicing, and my mother-in-law is also Ayurveda doctor. So we are talking Ayurveda all the time. We are eating Ayurveda, we are discussing Ayurveda, all the time it is Ayurveda in the house.
So it's also a love story behind this, and it's very interesting, very nice. Maybe if we move back towards your presentations, was there any unusual response presenting the treatment of Ayurveda, which you remembered for a very long time. Was there something unusual? What you said? Oh, I didn't expect this
Expect from the audience.
from the audience, or even maybe even from other doctors. Some example.
Mm, uh, there were many times, there are many modern doctors who are in the seminars, many classical doctors. They are in the seminars and they start to argue. And I remember once there was a doctor, she started arguing from modern perspective. She was not a believer of Ayurveda. She was there just because somebody told her to be in the seminar. And she started arguing. I didn't expect that. But later on, uh, she agreed that whatever is I'm teaching or preaching is true. So I was not expecting somebody just for the sake of telling me that this science is wrong will attend my seminar. And that doctor is still using herbs. It is 15-year-old. I'm talking about 15-year-old scene. And that doctor is still now fully into Ayurveda. She's practicing Ayurveda. She believes in Ayurveda. So that is very unusual experience.
Maybe this is the last questions. The last question. What do you wish for the future? What are your plans?
In my future, I don't have any goals. My future is the journey. I'm enjoying the journey. The goal is endless because I have to spend many lives if I want to achieve this goal. So my future is that I want to spread this beautiful science all over the planet, as I named it, Planet Ayurveda. So it will take time. It is taking time. I have spent about 25 years, and I have covered some countries. In fact, many countries. So there are many more people. I want to tell them about this magical science, and I want to share my experiences with them. And the journey is long, but I am ready for it.
Um, Thank you for this interview, Mr. Chauhan. I wish you pleasant stay here in Slovenia. In Slovenia, there is also word love, so spread the love all around the world.
Yes, yes. Thank you very much. Thank you. I can see people are very, very loving, very caring, very sensitive, and very passionate. Full of the place is full of nature, natural beauty. So thank you very much for inviting me to Slovenia. I will definitely take an impression of this very positive vibrations from Slovenia to my country. And thank you very much.
Thank you for your answers.
Thank you.
This is the end probably now of the interview. So it will be published in radio on the radio in the next few days, but it will be a little bit shortened because we are time limited.
Okay.
So
Okay.
I will have just maybe a few responses from Mrs. Maria. And hvala za pozornost, spoštovani poslušalke in poslušalci. To je bilo to.
Okay.
Okay, this
Thank
will
you.
be. You're welcome.